Can Kinesio tape relieve carpal tunnel syndrome? New research explored. Welcome to Chronic Life Success. Today, we are uncovering an exciting new development for carpal tunnel syndrome. A recent study suggests that Kinesio tape, a favorite among athletes, might be the helping hand you need for managing CTS symptoms. Let's dive into these findings. So, carpal tunnel syndrome affects 4 to 5% of the population, often causing pain, numbness, and muscle weakness. Common among women and those aged 40 to 60, it stems from pressure on the median nerve in the wrist. While severe cases may require surgery, mild to moderate CTS is often treated with therapies like TENS, ultrasound, or splints. But what about Kinesio tape? Could this stretchy athletic tape provide the extra relief? In a recent study, researchers in Taiwan explored Kinesio tape as a complementary treatment. Over 6 weeks, 27 participants received the standard therapies, with half also using Kinesio tape. The tape, applied twice a week, gently lifts the skin, boosts blood flow and muscle activity, and it was left in place for 2 days at a time. Here's what they found. Both groups showed improvements in pain, grip strength, and daily function. The Kinesio tape group excelled in hand grip strength and sensory conduction. The Kinesio tape group excelled in hand grip strength and sensory conduction velocity, while the control group saw greater gains in nerve-related measures like motor distal latency. So, while Kinesio tape isn't a cure-all, it seems to add real value when paired with traditional therapies. Of course, no study is perfect, and this one lacked a placebo control group and didn't measure long-term effects. Still, it opens the door to future research and highlights the potential of this simple, affordable therapy. What do you think about Kinesio tape for CTS? Have you tried it? Please, let us know in the comments. And I'd like to bring up another article tonight. And so we have a new cancer breakthrough. Monocytes are the key to advancing immunotherapy. So researchers have identified a key player in the fight against cancer, monocytes. Let's explore how these immune cells could revolutionize treatments for patients battling resistant cancers. Immunotherapy has been a game changer in treating cancers like melanoma and lung cancer by using the body's immune system to fight the tumors. However, not all patients respond to these treatments. For example, over 50% of melanoma patients do not see lasting results. Why? Because cancer is sneaky after all. It alters itself to evade immune detection. But this new study sheds light on a critical missing piece in our understanding for immune activation against cancer. Traditionally, dendritic cells have been seen as the main activator of T cells, but researchers discovered that monocytes also play a pivotal role. These cells can borrow cancer antigens in a process called cross-dressing, reactivating T cells within the tumor environment. This reactivation is essential for T cells to perform their cancer-killing duties effectively, and it is a step that has been missing from our understanding of cancer's immunity cycle. Unfortunately, cancer does not make this process easy. Tumors produce a molecule called prostaglandin E2, which blocks the activity of monocytes and dendritic cells. At the same time, they suppress the interferon production, further weakening the immune system's response. By targeting these pathways, we could turn the tables on cancer. Here's the breakthrough. Researchers found that COX inhibitors, like aspirin, can block prostaglandin E2 while boosting interferon levels to re-energize T cells. These drugs, when combined with immunotherapy, could offer new hope for patients with resistant cancers. This approach isn't limited to one type of cancer either. It holds the potential for treating lung, pancreatic, colorectal, and other cancers with similar pathways as melanoma. Clinical trials are already on the horizon to test this combined approach. If successful, it could make immunotherapy a viable option for many more patients, breaking down resistance and improving outcomes. Researchers are also exploring how monocytes can work with other immune cells in different therapies, paving the way for even more innovative therapies. This discovery is a reminder of how far we have come in understanding and treating cancer. What are your thoughts on the potential monocyte-targeted therapies? Let us know in the comments below. Don't forget to like and subscribe. Hit that bell for more updates on medical breakthroughs. And if you enjoy this content and would like to support the channel, please check in the description for how you can do that. Thank you and have a great night.